And we have a list showing some of these. And Dr. Harris, if we can go through these and explain as to how cardiac rehab can be beneficial if you've experienced one of these conditions.
Absolutely. So let me run through the list. So when you're talking about different types of presentations of heart disease or heart attacks, there's a whole gamut. There's a whole spectrum of disease and how it's portrayed. So stable angina is something that you're having with regular exercise, regular activities. You get the same type of symptoms, whether it's shortness of breath or chest discomfort, with the same level of exercise that you're doing,
right.
Or same level of activities that you're doing. Some patients will tell me, doc, every time I walk up 2 flights of stairs, my chest hurts, I have to stop, I have to rest, and then I can keep going.
Right.
That is very typical for the type of patient who has stable angina. A heart attack or myocardial infarction is basically to the point where that plaque has now become occlusive and obstructive, and patients are going to have significant amount of chest pain, like I had described earlier. The typical squeezing or tightening or discomfort in the center of the chest, radiating to the back, sweaty, nauseated, and usually will last for over 30 minutes.
When they're like grabbing right here,
right,
because
exactly.
they feel that pain.
The old adage was an elephant sitting on my chest.
Okay.
So if we're doing that for 30 minutes, I mean, that's more consistent with a potential heart attack. Heart surgery basically is the ultimate treatment for heart disease, where you have to have bypass surgeries. I describe this to my patients as kind of like a highway that's blocked. You develop these bypasses, and that's what you can develop them naturally. Most of the time, a lot of patients who end up having significant disease need it to be done surgically. And we have a great surgical center here at Baptist, which has helped a lot of patients. Angioplasty is another approach to treatment for heart disease. It's the gold standard for diagnostic heart disease when we're looking with cardiac catheterization. Doctors, interventional cardiologists who specialize in this can go in there with very small catheters. They can look at and see these obstructive lesions, and they can open them up with a balloon, with angioplasty, and then ultimately with a stent.